Title and Nick will be exploring their arguments for why they should win too.
8:54 now. We often hear how small changes to lifestyle can have massive health benefits, but it's not something that doctors are formally trained in.
Not yet. Dr. Rangan Chatterjee wants to change that, and with the backing of the Royal College of GPs, he's created the first training course for doctors on how to prescribe what he calls lifestyle medicine, rather than relying solely on traditional medication.
Yes, he joins us now, along with one of his patients, Nicholas Singleton. Very good morning to you.
Morning.
So, in a way, this is a story about a success, a health success story, which is always good to hear. Nicholas, just take us to the before and after.
Well, before I had fibromyalgia, ME, chronic fatigue, issues with my thyroid, massive issues with anxiety.
And what was life like at that point?
Miserable. It was absolutely miserable. I couldn't stand for 10 minutes without being in pain. I was more like a spectator. So if I was watching my children grow up without me because I couldn't join in.
And what was the medical profession saying to you at that time?
They were trying, but it was, I would go because I was in pain, particularly with the fibro, and I was told medication. So
and then something changes. You have a different approach.
Absolutely.
So what happens?
Oh, I felt like crazy with a different approach. I didn't understand it initially, but what happened with the process through Doctor in the House and through Rangan has completely changed my life. I have my life back.
What were you told to do that was so different to what you've been told before?
Completely changed my diet.
Were you eating unhealthily?
I love sugar.
Okay.
I used to like baking, so the way I used to word it was we'd eat healthily but have too many snacks. So I haven't baked for a year because it's just too much temptation. So no, I didn't really eat healthily. I'd be lying if I said I did. No, I didn't look after myself. I was too exhausted. Because the problem with fatigue, you see, you are so tired, you will eat whatever's in front of you. And if that's a bag of crisps, rather than making yourself something, you will always go for that bag of crisps because you're just too exhausted. So it's a bad cycle that you get into.
So, Dr. Chatterjee, what is different to perhaps not saying to Nicola, sort your diet out a little bit and that will help, to what you're saying GPs now need to learn to do?
Yeah, that's a great question. Look, I don't think Nicola's diet was actually that bad.
Right.
Okay, so I think it's important to realise that we know things like type 2 diabetes and obesity can be improved with lifestyle. I don't think that's news for anyone, but I do think that even for those conditions, we need a bit more training so that we can better signpost patients as to where they need to go to get, better, high-quality help. But Nicola was a case of someone who was on 20 pills a day. She had a good 6 or 7 diagnoses. So she had chronic fatigue syndrome, fibromyalgia, anxiety, irritable bowel syndrome, an underactive thyroid. And despite all the medications, right, she was still feeling really bad. She couldn't be a mum to her kids in the way she wants to. She couldn't work. Now she can go up Rivington Pike in, Bolton, get to the top of that. She could be a college governor.
What did you change?
I changed a multitude of different things. So if we talk about movement, for example, everyone knows we need to exercise. Well, actually, Nicola was trying to exercise every day. She was dragging herself to go round the block for half an hour every single day, but that was actually making her worse because she had an issue where her mitochondria, which are the organelles in our body that generates energy, weren't functioning as well as we would want them to. That was part of the drive behind her condition. So I said to Nicola, at the moment, actually, you're not well enough to do that movement. I need you to stop whilst we do some other things to help repair those mitochondria.
Well, I'm just curious about how life is now for you, Nicola. You painted a very rosy picture. You've got, is it 3? You've got 3?
I've got 3 boys. I've got
3
Cameron,
boys?
Logan and Zachary, and an amazing husband. He is seriously amazing. But my life is colourful again. I was saying to Rangan before, my life before was just grey. It was miserable. It was a slog. Every day was a slog. And now it sounds corny, but it's beautiful.
The thing that occurs to me is that this is a message to GPs, isn't it? You want them trained. Someone's watching this programme and seen this great story. This is a wonderful success story. And they go into their GP and they've got a number of conditions and they say, I saw someone the other day talking about, my lifestyle. Could you talk to me about that? And the GP says, well, do you know what? Yes, we eat better. I mean, how seriously are GPs going to take it if people want the kind of advice you clearly have given to... You brought in a couple of patients today. Is it going to be within their grasp?
Yeah, well, at the moment, no, because we're not trained in it. So we've got, as I said when I spoke about an hour ago, we already filter a lot of complex information. I'm just saying that we need to add a skill set, a new skill set. The health landscape in this country is changing. Right? We're now seeing a majority of conditions walk through our door that's putting strain on the NHS. You talk about 10 minutes. These are patients who are coming back week after week after week because we're putting them on medication and they're still not feeling better. So they are putting more strain. And actually, I go around the country talking to doctors, and doctors want this training. They're saying, well, we don't know what to do. And again, we do have other healthcare professionals who we can refer to, but we need that base level of knowledge, because I want these results to be available to every single patient in this country.
Thank you for your time this morning. Thank you for sharing your story with us. Thanks, both.
I'm glad life is beautiful.
It is.
That's